All right, our next speaker is Pooja Shah. Pooja is the CEO, co-founder of Mindly Care. And she said she only needs one slide, and that's it.
Hello, everybody. First of all, I wanted to thank Uli for inviting me to this panel. I'm quite honored. And yeah, thank you for seeing my presentation. So my name is Pooja. A little bit of background on me. I graduated from UC Berkeley a couple of years ago studying cognitive science and data science. I've always had a very big passion for mental health and wellness. And during the first 2 years of my college career, I interned at an autism lab called the Wall Lab at Stanford University. And over there, I researched potential genetic triggers in the body that cause comorbid disorders and, other neurological conditions. And that very much sparked my interest within autism, but specifically on the intervention side. So being able to effectively track progress of behavioral symptoms in relation to different types of interventions. And so during my time there, I met a lot of clinicians, educators, parents who either have kids with autism or work with kids with autism, and identified quite a few gaps within the data collection portion of behavioral symptom tracking, and specifically the lack thereof of being able to accurately track symptoms in relation to medication, different types of therapeutic approaches, and academic curriculums, as well as lifestyle factors. And that really brought Mindly to life. And during the end of my senior year, I decided to go full time with this. And once again, when I was talking to a bunch of the professionals in the space, I realized that current autism care relies very heavily on manual observations and manual documentation, as well as disconnected tools. Parents, teachers, providers oftentimes operate in silos, unable to effectively communicate with each other. And my co-founder and I, Srinaja, who I've been best friends for about 20 years now, realized that without a data-driven approach, care is often inconsistent, inaccurate, and also progress oftentimes stalls. So we decided to develop Mindly, and feel free to scan our QR code to check out our website. But Mindly is an all-in-one comprehensive care platform that unites parents, educators, and providers to deliver holistic, real-time, and data-driven support for autism care. And the way we do this is through two ways. First way is through AI-driven video tracking, as well as automated documentation to identify behavioral patterns across the school, home, clinic settings, amongst other settings, maybe at the playground or at a friend's place. We really wanted to give a full picture of a patient's profile, or at this point, a child's profile. And we tie these patterns back to medications, different type of therapeutic approaches, as well as lifestyle factors, such as sleep, diet, and stress. And from IEPs to clinical notes, from stress triggers to previously exposed allergens, everything kind of all lives in one place. And we then generate AI-driven insights based off of the data available on our platform and provide personalized reports so that every care plan is not just accurate, but it's adaptive. And by centralizing data and enabling real-time collaboration between care team members, whether, once again, you're at a school or whether you're at a clinic or another service provider, that really showcases faster, smarter, and more improved outcomes. And so Mindly, at its heart, is about honoring every child's story or every individual's story and being able to empower care team members with the insights and the support necessary to respond with empathy, precision, and collaboration. And we're currently implemented across the United States in schools, clinics within specifically California, Texas, New York. And we're also looking to expand globally because we've seen quite a big need in places like India, Australia, South America. And we're really looking forward to partnering with larger healthcare institutions as well as research institutions to kind of integrate data and make sure that we are able to connect every dot when it comes to care. And so once again, we're looking to also in the future be able to generate enough insight when it comes to the different aspects of a child's life. And we really want to be able to bring together the care team as well, because we want to make sure that progress, whether it's in the form of goal tracking, assessment tracking, or even being able to figure out whether sleep impacts cognitive behavior or whether sleep impacts aggression. We want to be able to really track those different lifestyle modules and be able to generate those acceptable and very effective insights, so that care can be not only effective, but also just very, very adaptive within the quality of care. So yeah, with that, thank you very much. I know I was a little bit of a shorter presentation, but once again, feel free to look at our website, and I'm happy to answer any questions after. Thank you.